Dr. Pageler, it's such a pleasure to meet you.
Pleasure to meet you too.
Tell me a little bit about your role at Stanford Children's Health.
I am the CMIO at Stanford Children's Health, so really the liaison between the physicians and the medical staff in the hospital and our information services department. And so my primary role is really taking in and implementing information systems in the hospital.
How long have you been at that role?
I've been officially at this role for the last year, but I've been with information services for the last 7 years.
Wow. Over that time period, the 7 years, how have you seen things change from an information standpoint?
It is changing dramatically and in very exciting ways. So I have been through 2 electronic medical record implementations, which are major events. But now that we have those systems implemented, we're getting to the much more exciting pieces of developing innovative clinical decision support and implementing that using a lot of analytics, a lot of kind of advanced machine learning techniques, and trying to get that into the hospital system.
So I think a lot of physicians, myself included, see the medical record as something that kind of takes joy away from the practice of medicine.
Right.
So how do you counteract, I guess, that attitude and really the reality?
Yeah, exactly. And it is a big, growing pain that we're going through. And so I think the electronic medical record is a huge endeavor to get discrete information and to give us the data that we will use to improve care. And so now we've got it in. It is a big change in processes, and now our next steps are to make it easier to use, make it better for providers to really get the worth out of it, and then to continue to build on this platform to really truly improve care.
What informatics innovations are you most excited about?
Gosh, there's so many. So I really do think now that we have access to these huge amounts of data, whether it's from the electronic medical record or from our genomics project or from our imaging that we're now getting digitized, there is so much opportunity to learn from this data and then turn that back, put it back through the electronic medical record and support our physicians and our frontline care providers in making better decisions for their patients. So really just taking all this data that we've so painstakingly gone through the efforts to be able to gather and making it now useful information.
And what do you think that the interaction between the physician and the medical record is going to look like, let's say, 5 or 10 years from now?
I think the medical record will drift more and more in the background, right? Mm-hmm. So we had this big first step where we just had to get it in, and then we had to, everybody kind of becomes data entry folks. Right. And so I really see us getting away from that. So some of the next things that are being worked on are how can we do more natural language processing? How can we do more can we gather data without people directly entering it, whether it's by audio technology or it's by watching what's happening and capturing it directly. And so I think more and more as our systems get better, the EMR will sync into the background and we'll be gathering data seamlessly, and the physicians can return more and more to focusing on that personal contact.
Oh, I really hope so.
Me too.
Do you think so? The electronic medical record and all the informatics tools we have enable us to collect almost an infinite amount of data on our patients. But probably at this point, only a tiny sliver of that is clinically useful. How do you weed through all the noise?
Again, a great question, and that's I think it really highlights the importance of having clinical informaticists. So we have a clinical informatics fellowship that we started here at Stanford with amazing physicians that are now coming through it and really looking at those exact questions. So helping to take all of this information, we always say we're data-rich, information poor. So taking all of this data and turning it into meaningful information and giving it back to the frontline providers in a way that's useful. So it's really step by step, project by project, situation by situation, creating tools that turn that massive amount of data into something we can use.
Wonderful. I look forward to a future where we spend less time in front of the computer and more time with our patients, but we're gathering more information.
Me too.
Thank you so much. Nice to meet you.
My pleasure. Thanks.